Hi, welcome to this special report on COVID-19 from the Washington Post. I'm Libby Casey at the anchor for politics and accountability. Today, we'll talk about the move by President Trump to politicize mask wearing, despite pleas from health experts to take the politics out of health. We'll also look at the toll the pandemic is taking on Americans' mental well-being, their mental health, and what this reopening process that's happening all over the country is looking like. But first, the United States has officially hit a grim and horrific milestone: 100,000 official deaths from coronavirus. Other latest news stories we're following. House Speaker Nancy Pelosi is calling this milestone a scar on our nation, and President Trump tweeted earlier today calling it very sad. Here's another difficult number. Americans have filed more than 40 million jobless claims in the past 10 weeks. And we're going to talk about the jobless claims more later on with our economics colleague, Heather Long. But my first guest today is Michael Shear. So good to see you, Michael.
Hi, Libby.
Not how I'm used to seeing you. Michael, national politics reporter who was covering the presidential campaign. And I was getting to see you out on the trail, on the road, which is where you were spending a lot of time before the pandemic struck. So, Michael, you're still covering the campaign, but now there are all these other facets to it, including how the coronavirus is impacting the campaign. So you filed this fascinating look at how President Trump is making mask wearing political and what it's meaning to Democrats and also other Republicans. So let's start with the basics. President Trump does not want to be photographed wearing a mask. We saw him yesterday down in Florida at the attempted launch of that SpaceX rocket, not wearing a mask. Ivanka was wearing one, grandkids were wearing one. Not President Trump, not the vice president. What does the president say about his messaging?
He said that he's not against the CDC guidelines, which recommend the wearing of masks. He's just not going to do it himself. And he's given various reasons for doing this. He said he doesn't want to give the press the pleasure of seeing him in a mask, suggesting he thinks it is a sign of weakness to be seen in a mask. He's also said it's politically correct to wear a mask, sort of dismissing those who wear the mask as if they're making political statements of their own. What's interesting about this is that it's an issue that is pretty much settled everywhere in the country outside of the Republican Party. The percentages of Americans who support wearing a mask when you're outside and you can't socially distance are over 70% for independents, over 80% for Democrats. It's only when you get to the Republican Party that there's some division here, and it's a particularly division with Republican men. Republican men are a demographic that has so far been pretty resistant to the wearing of masks. The result of this is that a number of other Republicans, many of whom are up for re-election this year, are a little skittish about what the president's doing, and there's two reasons for that. One, there's a group that are actually interested in public safety, people like Mike DeWine, the governor of Ohio, the governor of North Dakota, who just want to prevent another resurgence of this disease and want people to wear their masks. And then there's another group of people who don't want to get on the wrong side of the politics of this issue where the president seems to be. It was interesting on Monday and Tuesday, as the president was sort of mocking Joe Biden for wearing a mask, both Mitch McConnell, the Senate Majority Leader, and John Cornyn, the senator from Texas, who's up for re-election this year, posted photos on their social media of themselves wearing masks. Fred Upton, who's a Republican in Michigan, who's got a tough re-election fight this year in a mixed suburban district, he's changed his Twitter handle to Fred Upton #wear your mask to show how devoted he is to this issue.
Michael, can I just mention, can I just jump in here? The picture of the Senate Majority Leader of Mitch McConnell showed him thanking healthcare professionals in Kentucky. And so it showed him alongside a woman, both wearing their masks, standing probably not 6 feet apart, but standing a couple of feet apart, just, kind of wearing his suit coat and his slacks, out doing his thing. And so it wasn't even like a selfie with him in the mask. It just showed him sort of going about his ordinary political life, mask wearing.
That's right. And I think it was notable just the timing of when that went up. It wasn't, he's been photographed wearing a mask before. It's not like Mitch McConnell has never worn a mask at that point.
Right, we see him in the Capitol wearing the mask, right?
Yeah, and actually on the Capitol, it's interesting what's happened there. That almost all, or pretty much all the senators, with the exception of Rand Paul, have adopted mask wearing consistently. Republican and Democrat, they all agree they do it whenever they're close to each other. Rand Paul, the senator from Kentucky, says that he doesn't have to because he considers himself immune because he's previously had COVID and recovered. And then the
Which, of
House,
course, we don't know if he's actually immune, and we can talk more about that with William Wan, who's been covering all the health aspects later. But there's no proof of that at this point, so it's just Rand Paul's idea.
belief.
Right.
Yes, that's his belief. And in the House, the number of Republicans who are joining the president in trying to avoid being photographed with a mask or defiantly showing themselves in more crowded situations without a mask is relatively small. It's a fraction of the sort of Freedom Caucus hard right group. It's not all of them. Jim Jordan sort of leading the charge. So it's not a broadly adopted sort of protest at the moment.
The photograph of John Cornyn was one of those selfie pictures where he's like really showing himself like actively wearing the mask, saying he and his wife were wearing one because they were flying. And he's like calling it easy peasy, right? Like, just like, what's the big deal? But the irony here is, of course, what the big deal is that the leader of his own party is the one essentially encouraging people not to wear a mask. If you're going with the do as I do model.
Yeah, Trump would say, I haven't said you shouldn't wear a mask. You can wear a mask. It's fine to wear a mask. He said versions of that before. He just doesn't choose to. But yeah, clearly he's not leading by example here. And what's interesting is how his Democratic opponent has sort of jumped on this and embraced it in a pretty dramatic way. Trump tweeted a not beautiful picture of Joe Biden in a mask from Monday, making fun of him. And Joe Biden basically took the same photo, it's a slightly different photo, and made it his Twitter avatar. He's embracing the idea that he is a leader who will wear a mask. He cares more about protecting the country, about leadership, than he does about his own vanity. And that's sort of the message that Biden is trying to get out there. And for the Biden campaign and Democrats in general, that's sort of the core of their broader reelection strategy at this point, is to make the argument that they are just more suited to handling this crisis and getting the country out of this crisis, and that Trump has been handicapped by his peculiarities and political instincts and leadership in office.
So I just want to dig a little more into just who's fighting wearing a mask, because it is, the president's social media presence, essentially calling it like unmanly, but it's also people who are very close to him. Like one of his sons has been, tweeting mocking pictures of Joe Biden. People who are involved in the campaign have been trying to take these jabs. So, Michael, is this like a concerted effort? How organized is the Trump campaign in trying to, show this as a stand the president is taking?
Well, I don't think you can put this on the campaign or the Republican National Committee, which is sort of an extension of the campaign at this point. They've mostly stayed away from it officially. Who has embraced it is Donald Trump Jr. and Dan Scavino, the White House official, sort of the social media director for the president. And they play day to day in a sort of right-wing liberal troll world of memes and Instagram shares. And basically their currency day to day are things that are meant to make fun of or mock liberals. And so they have adopted this mask issue as sort of the latest version of that. I think they're going to move past it when they can. And I think it's different in a way than some of the other memes that they've seized on, because this is one that hits home for a lot of Americans. This is one that, like I said, 70, 80, 90% of the country, depending on how you ask the question, what poll you're looking at, believes should be happening. And so when you're making fun of something that's an issue, a 70, 80, or 90% issue for the American people, it's not that funny, and it probably won't work to your benefit. But you have seen that happen, and we'll see what the president does. It's totally possible that in 3 weeks or a month, the president will put on a mask and say, I like masks. They're great.
Well, in the meantime, one of our colleagues, Teo Armas, who reports for like the morning mix team, the folks who are up like super early at the Washington Post, getting the first stories of the day, he reported a story for this morning about some businesses, of course, a very small minority of businesses, but businesses that are telling people not to wear masks in places like Elgin, Texas. Like, you may not come into my establishment if you are wearing a mask. And they're making this about freedom and oppression. So that message the president is making is resonating with some Americans.
That's definitely true. But I think the key word there is some. It's a relatively small percentage. We saw the protests at the state capitals for several weeks now. those are not broadly supported protests. There are a lot of people who would like to get their states and their communities open quicker, but there are not a lot of people who want to go out and stand next to somebody else without a mask. It's interesting, all 50 states right now have this guidance that you should wear a mask in public when you can't be more than 6 feet distant from other people. A lot of major corporations, major retail establishments, supermarkets, pharmacies, things like that have mandates that you can't come into their stores without masks. But it's still a minority of states that require them. And most of the requirements come in workplace settings. They're basically workplace enforced rules that you can't force an employee to go back to work if you're putting them next to somebody without a mask on, because you're going to increase their danger. And I think you will have some probably litigation and fights along those lines. But in places like Texas, it's a guidance for Texans, and people are making political stands, but they're not really consequential, or at least at this point, broadly adopted.
So let's talk more about this tough spot. Essentially, President Trump's messaging is putting some Republicans in, right? There's some anxiety among Republican leadership who, number one, want to see people, if they're governors in their states, wear masks to be safe if they're appropriate, but also are kind of questioning just what the political fallout of this might be. So you mentioned the Ohio governor, but let's also talk about the North Dakota governor, because he gave this speech that got so much play and interest around the country because he was giving this impassioned request for North Dakotans to, as he said, dial up your empathy and understanding and recognize that if someone's wearing a mask, they may be protecting a 5-year-old child going through cancer treatments. His voice really broke. He seemed like he was going to cry, and then talked about protecting the elderly, and asking for this to be a unifying thing rather than a divisive thing, Michael.
Yeah, that's right. And it gets to a core part of why people are embracing the mask. The mask is not to protect yourself. Unless you have a N95, a surgical mask, you can still get sick wearing a mask. What the mask does is prevent your spittle from spreading further than a few inches from your face, so that you're not infecting anybody else if you happen to have it and are asymptomatic. I think one of the other things we know from this campaign so far is that governors have done very well in terms of popularity and getting their states behind them by making the case that what they're doing at this moment has nothing to do with partisanship, has nothing to do with politics, has nothing to do with taking sides of one side or the other. It's all about doing whatever they can to help as many people as possible. And you see that with almost all the governors doing that right now. And you also see it in their approval ratings. I mean, governors right now are the most popular politicians in the country, again, with sometimes approval ratings in the 70s. Which means that a lot of people from their out party, if you're a Republican governor, a lot of Democrats are saying they're really happy with you right now. And Democrats, a lot of Republicans are saying they're really happy with him right now. And the president's just taken a different tact to respond to that. And it's just his instinct is to play a different kind of politics. And I think he's running into the challenges of that. And I think his campaign is right now really struggling with how to navigate that, the president's instincts versus the politics of the moment.
Let me welcome James Hohmann to the conversation, national political reporter. Hi, James.
Hi, Libby.
Michael, before I go to James, though, I would like to hear more from you about just what this may mean for Republicans as the strategists, and we'll hear from you, James, about this as well, as they think about 2020, and if this puts Republicans in a tough spot. I mean, if you're having the leader of your party imply that it's unmanly to wear a mask, and then you're trying to message to your constituents and say, well, I'm wearing a mask, I want you to wear a mask when it's appropriate. Are they concerned about the political fallout in November? Let's start with you, Michael.
Yeah, I think there is concern, and it won't be about masks in November. Like, if we don't have another real dramatic resurgence that leads to another shutdown that puts us back in the position we are in, I think the mask issue will probably have faded by the end of the summer. People will be wearing them. People will be more used to them. It won't be as much of a cultural signifier as it is right now. I think the issue, though, is that the question of this election, and Democrats and Republican strategists all agree on this, is going to be, what can I do at the ballot box to make my life better, to get our country out of this rut, to help myself economically, to get the disease taken care of? People, more than most years, have a real reason to vote now. Their leadership, their political leadership matters. And both parties are going to be campaigning as the party and the candidate to carry that flag, to be able to improve the country. And I think the mask issue will end up being one of the data points in that argument that Democrats will make, and that Republicans will have to deal with. And it's very possible also that Republicans who are embracing masks right now will be able to distance themselves from the president some, and won't suffer that blowback come November.
James, what are your thoughts on that?
Yeah, I agree with Michael, and I think it's really notable that the examples we talked about a couple minutes ago are all folks who are up for re-election in November. Mm-hmm. Even Mitch McConnell facing a tough re-election fight that's going to be expensive. John Cornyn too. But the people that you're seeing, Tom Tillis in North Carolina, really make an effort. I do think it's sort of a subtle way of distancing. It's a way of appealing to kind of suburban moderate women who voted maybe for the president in 2016, but voted for Democrats in the 2018 midterms, that Republican down ballot candidates need to find a way to get back in the November election. And so I agree that the election isn't going to be decided on masks, but I do think it's not just a signifier in the culture war. It's also a signifier of how seriously do you take this? Are you listening to the scientists who remain overwhelmingly popular? And this will be kind of a data point in the back of voters' minds come November, when there are a lot of very good reasons to vote.
And of course, one key voting bloc is the elderly as well.
Yeah.
And so they're going to.
The counter to this, and it'll be interesting to see how it plays out, but the counter to this will be if the disease actually just does start to fade away. We don't know what's going to happen with this. And Trump can make the argument that he was on the leading edge early in pushing the economy to reopen and pushing to get your kids back to school. There is a possibility, and Democrats don't dismiss this out of hand, that he will then be able to argue into November that he is once again sort of the economic president, the one who's fighting to get you back to work to improve your economic situation. And that's sort of the bet, I think, that the president's making right now, that we won't have another resurgence of this, and that the health fears will diminish considerably. And I think it's sort of a long shot bet at this point. We don't know the exact odds, but it's not at all certain that will come to pass.
Michael, finally, before we let you go, what is it like covering the presidential race right now for someone who's usually on the road so much? And yeah.
Well, everybody I cover is also stuck in their homes. So it's a lot of talking to people on the phone all day long. And it's interesting, just like, pollsters say now that it's a great time to be a pollster because everyone's picking up their phone at home. And it's really easy to get response rates. It's not a terrible time to be a reporter either, just because no one else is on a plane. Everyone else is sitting around all day, and you can call around and find out what's going on. It's a lot more. I mean, it's less in-person reporting. Obviously, it's more the mechanics and what's going on behind the scenes. But it's certainly still a very exciting time in politics.
All right, Michael Scheer, thank you so much. I look forward to continuing to read your byline, even if I'm not seeing you out on the campaign trail. So we'll talk to you soon.
Thank you, Libby.
Thank you. James, we've hit this very grim milestone, this 100,000 deaths. And, I think we're all trying to wrap our mind around what that means, both on a very deeply personal level as well as the national level. When we think about where we were a couple of months ago and where we are now, I'd like you to reflect a little bit for us on what the experts thought about hitting this 100,000 milestone. Did it seem like it was a reality? Did it seem like something we were going to hit? And before we let you do that, I'll just say hi to William Wan, health and science reporter. Welcome. So James, just a couple of months ago, when the pandemic was hitting the United States, we were hearing different numbers. Was 80,000 and 100,000 too many people? Would that be sort of a lucky break if we could only get away with losing that many people?
Right, and the president, the first time he weighed in on this grim milestone, it's helpful to sort of think about this as, this is half the population of Salt Lake City. This is larger than the population of Kenosha, Wisconsin. And to your question, there was the Imperial College model of London that said up to worst case scenario over a couple of years, 2.1 million people could die, and the president has sort of seized on that to say, well, look, 2.1 million people haven't died. Which some have found to be callous and kind of preemptively defensive. A month ago, in mid to late April, the president was saying 100,000 tops upper bound, and it would probably be less than half of that. So they've certainly moved the goalpost. Dr. Birx has moved the goalpost some too, and said we always said it would be this high. But in fact, you can go and play the tape from some of those early briefings. Ultimately, I don't think people want to litigate who said what. It's very clear that the president, when there were 15 cases, said soon it would go down to 0 3 months ago. Obviously, that was wrong, and but that it's easy when you kind of talk about that to get lost and lose kind of the forest and the trees, or lose the trees and the forest. And the trees and the forest are the people, the faces of the fallen. And we've really made a big effort as a newsroom to tell their stories, and it's not just famous people and celebrities, and it's not just, we told the stories of grocery workers, who signed up for extra shifts because they needed the money, of husbands and wives who have passed away, obviously lots of people in nursing homes. And so I think the 100,000 milestone is a moment to reflect on some of the very human loss. A poll last week showed that 14% of the country knew someone personally who has succumbed to the virus. And obviously, the economic toll is very significant too, and the mental health toll is very significant. But I think that this is a moment to not lose sight of the human cost of this. And it's just so staggering that it's easy to kind of just say the number, but it's 100,000 people with families.
What you're seeing there, that headline, 100,000 deaths, is really a beautiful piece written by Mark Fisher and illustrations by our team members, Laura Tierney and Tim Miko, where they made like beams of light representing each of the deaths. And so I encourage you to go to WashingtonPost.com and search for that story, because it really is startling to see that and see what parts of the country have been disproportionately impacted. And, we've seen colleagues in the newsroom lose loved ones. When you talk about that 14%, James, of people who say they do know someone who's died of coronavirus. William, as a science and health reporter, what does this milestone mean to you? What are you watching for? Because of course the deaths don't stop right now. It's not like we've hit a cap and everything stops or resets.
In some ways, it's so significant in a lot of ways, and in some ways it's not. One of the points a lot of these epidemiologists were telling me is, we are getting tired. We are starting to think differently and react differently. The virus does not change. In some ways we are where we were in the beginning. The virus is still spreading, kind of highly transmissible. And so there you have like these two things going on that are kind of at odds with each other. But yeah, the 100,000 deaths, I mean, when you look at just other leading causes of death, it's kind of crazy how quickly this has zoomed up there, along with heart attacks, suicides every year, smoking. Like this is like right up there now with it, and it's just really disconcerting, just as a health reporter, to see something come out of nowhere. Yeah.
We're going to talk more about sort of the economic toll a little bit later in our show with Heather Long. But William, you filed an important piece with our colleague Alyssa Flowers about a Census Bureau study that's showing so many Americans are suffering from signs of clinical anxiety or depression. So what did the Census Bureau, what were they looking for, and what did they find?
It was just fascinating data. They had started a weekly survey, an emergency survey that they were sending out to try to get a sense of the coronavirus. So in that was like questions about housing, finances, spending, just your general census kind of data. But they buried in there, this is a very long survey, they buried in there 4 questions that they rarely asked, that they took word for word from these clinical screeners. So this is when you go to your primary doctor, these are screener questions they'll ask you to try to screen you positive or negative for depression and clinical anxiety. And the results were kind of just really alarming. It showed about a third of the country essentially screening positive for clinical depression or anxiety, one or the other, or both. And a third is just, it's an amazing number. We looked at some studies from previous years before the pandemic, and some of the answers to the questions were double those from like even as close to us now as like 2014. Yeah.
James, and we were hearing from psychologists so many causes for concern, isolation, economic insecurity. If you're afraid you can't put food on the table for your family, or that you're bringing home a deadly virus to them, that creates a lot of anxiety. But some of the places that Americans go to find sort of sanctuary are also not available to them, like churches or places of worship. depending on what your religion is. But
Yeah.
we're hearing this fight right now over how soon houses of worship should be opened and whether or not it's a smart or foolish call. So where is that at?
So what happened was early last week, we finally got the much awaited CDC guidance. Originally, it was 60 plus pages, kind of, how to open schools, how to open restaurants. And one of the packages was on how to safely open churches. And there was pushback at the White House from kind of leading social conservatives in the vice president's office, but also at the Office of Management and Budget and then the Domestic Policy Council. So they decided not to release that information. That actually was kind of, they thought it was inappropriate for government to tell churches what to do. In fact, it wasn't telling churches what to do. It was sort of best practices for here's how to be smart about it. Don't have choirs, because when people are singing, they're putting a lot of droplets in the air. Don't pass an offering plate, have a stationary offering plate, stuff like that. But the result of not putting out federal guidance was that a lot of churches sort of don't know what to do. A lot of pastors in places big and small. So in my home state of Minnesota, the Catholic Archbishop for the state and the leader of the Lutheran Synod, one of the two Lutheran synods in the state, said, we're just going to open, even though Minnesota's governor still has a stay-at-home order, still isn't allowing gatherings of more than 10. They said, we're just going to start this week, and they have. We need to, in this difficult time, be there for our flock. But most pastors in Minnesota and elsewhere say it's not safe, even though the CDC hadn't put out that guidance. And I'll say that they did in a second. I'll explain why. The CDC has put out 3 different reports tracing the spread of the coronavirus that were kind of directly related to churches. And so in Arkansas, a well-meaning asymptomatic pastor and his wife ended up infecting more than 60 people in their congregation, some of whom died. And the pastor feels terrible about it and didn't intend to, obviously, unwittingly. And so that was sort of a wake-up call that if you're really, having these gatherings, and a lot of people who are attending churches and service are older. There was a similar story in Chicago and Washington State. So anyway, last week, under pressure, as churches started saying we're going to reopen, the president said on last Thursday we're going to put out the guidance that was held back. But then instead of doing that, they did put out the guidance that had been held back. But then Trump also said, I'm pushing churches to open. We're going to make churches open. They should open right away. It's important that they are essential. I'm deeming churches essential. Now, a lot of churches still are not opening. They don't think it's safe. I've talked to a lot of pastors about this over the last couple of days. And, that kind of died down. That was the story of last Friday afternoon. But these are hard choices because the virus is not going away. As some of these orders get lifted in a state like Minnesota, right now, more people can gather in a retail store than are allowed to gather in a church. So some pastors say that's unfair. And maybe it is. So they're going to have to figure out a way to eventually kind of phase back, but in a way that's maybe outdoor services. A lot of these conversations are ongoing, but this is another example of like what we were talking about with Michael a couple minutes ago, where the president has waded into the culture war. The president on Friday said it's essential people go to church. On Sunday, he went golfing instead of going to church, which a lot of people noticed. But this has kind of now become this latest front, this battle, and in signaling. But a lot of people don't want to go to church. A lot of elderly people don't want to go to church. So even if you open them, people aren't necessarily gonna come.
William, we had a question written into us from Elizabeth, who lives in Baltimore, Maryland, and she asked, in areas with low coronavirus rates, what is likely to happen as things open up? And she asked, is there a danger that outsiders will come in and bring the virus with them? And she also wanted to know if this could be especially difficult in areas that have not built up any herd immunity. But of course, none of us have built up herd immunity at this point. So that's a long way off. But she asked such an important question about what do we know about what we'll be watching for next?
This is a really great question. It's a little complicated in that it's not necessarily one-to-one that as soon as you open up, the rates are going to go up. What happens is the probability of the rates going up will increase. Mm-hmm. And so if you have states that are really rushing towards reopening, like Florida, Georgia, a lot of us who would like, who would think, well, this governor should have their comeuppance. It doesn't necessarily happen that way, but the probability of that rate going up will increase. And so you will see, I think, automatically, cases are going to increase across the country as things reopen. It's just a fact of science. Your contacts increase, and so the chances of the virus increasing will increase. But there's also these instances of super spreaders. So like you have, for example, a church where one incident of a choir, one person infected like 50 others. And so outbreaks can happen very, very quickly. So even places you're starting to see rural areas, Midwest, that had very low rates because the density was not there. They're starting to see an uptick in cases. And so these super spreading instances can happen very quickly without any kind of warning.
James, it begs the question of what's changed in the past 3 months, right? Like, what has America been able to do? What are we better at now than we were a few months ago? We're all better educated about how we act around other people. We're all better educated about how to sort of avoid transmission if possible. But what has changed in terms of testing,
Mhm.
safe spaces, and then tracking when someone has a confirmed case?
Well, we've made progress, and it's important, Libby, to note that. Obviously, you think about where we were on testing 3 months ago and the early mistakes. So testing is leaps and bounds beyond where it was in terms of the access and availability of testing. Some places have more tests than they know what to do with. In DC here, they still don't have enough reagents to be able to process all the tests. So it's sort of a patchwork. There still really isn't a national testing strategy. But the virus isn't going away. And one of the things that I think you'll see is at some point testing might become ubiquitous enough where you kind of go get a diagnostic test before you go see grandma and grandpa with the kids. But so we've made progress. We're not there yet. Contact tracing, we've not made a lot of progress on. Some states have done a much better job than others. Some local counties, so here in the DC area, Anne Arundel County in Maryland is really a model. They basically hired all the school nurses to go, from all the schools that had closed down to do contact tracing. So they're calling through and tracking down people that had contact. It's hard, arduous work, but there's really not a federal significant effort underway. To your question of what have we learned, I mean, we always knew the idea of flattening the curve doesn't mean that there was no curve. It meant that the curve was flattened. And the idea of that was to give enough time for hospitals to be able to build up capacity so that they wouldn't be overwhelmed and we wouldn't have people dying in the streets or in their homes like we saw happen in Italy. And there is evidence that in most places, they now have dramatically increased hospital capacity. So here in DC, for example, the convention center, all the conventions and events have been canceled. If you go into the convention center right now, it's a field hospital. They've set up dozens and dozens of beds. They're not in use, but if all of a sudden, DC's letting up its restrictions starting tomorrow, all of a sudden, there will be an increase in cases. The question is how much of a spike. Will it be a spike? Will it be something subtle? We hope it's small and there's not a ton of super spreaders or whatever. But one of the calculations, one of the criteria that DC was waiting on to be able to relax the restrictions was expanding the hospital capacity. And so now they have done that. And so that's one of the reasons they can do that. So we've not gotten rid of the virus. We've made some progress on a vaccine. William actually has a fantastic story in today's newspaper in which he quotes a lot of really, top epidemiologists all saying we kind of wasted this time in a lot of ways. And I thought that was really interesting. There's a lot of things that should have been done during this time that weren't.
William, why don't you jump in on that? I mean, when James listed so many important factors to where we are right now, but when you look at how far we've come and yet, what we haven't been able to achieve in these 3 months, what stands out to you?
I guess if I were to just pick one thing, it would be the frame of mind that we're in. I think that's the most important weapon in all of this. Testing is important, contact tracing, vaccine is crucially important, but like our mind frame is kind of one of the only weapons until we have a vaccine that we have against this. And so that's the thing that's really concerning to me, is that I think a lot of experts thought by this point we would be better educated and also better mobilized and united against the virus. And it's really worrying to see the kind of fight against the virus become almost a moralistic thing on both sides. So you have people kind of lecturing about, like, you're not social distancing, you're not doing this, and then others saying, like, making fun of people wearing masks. And to see that playing out, I don't think none of the kind of scientists really, when they were doing their modeling, foresaw the way things are playing out now. And I think that's one of the most important things, is that in the long term, we have to think a lot more about, like, how to get public messaging and unite the public.
I want to ask you more about that, and so the quest for a vaccine and what it might really mean in just a few moments. But first, we got this question in from Fred, who lives in Spring, Texas. And Fred wants to know, why doesn't the medical community tell people it's in their own best interest to wear a mask? Because Fred is concerned that maybe telling them that they're helping their neighbors, they're helping others, isn't motivating them enough. So Fred is wondering why the experts aren't trying to appeal to people's base desire to stay healthy. William, as the scientists and medical experts that you interview and talk to think about their approach and how they talk to all the rest of us, are they factoring things like that in?
It is, I mean, that's a really great point. The problem, I think, with public health messaging is you want to be as honest and as open as you can. One of the key things about masks is that it keeps you from, infecting others if you're asymptomatic before the signs are showing. And so you just have to be honest with people. I think if that was the approach you took, complete honest and transparency, I think it would help a lot. The problem here is that you're getting conflicting messaging. I think people would be. I don't think people are opposed to helping others, being altruistic, or even like helping themselves in a larger sense, in that we're protecting society. If one person has it in a small community, the chance of other people getting is much higher, right? And so I think if people were just honest and open and transparent, especially, and there was not conflicting messages, it would go a long way and it would actually work. Yeah.
And we've certainly seen that in other countries that have perhaps a clearer messaging and not the political divide over basic things like wearing masks. William, I want to read the first sentence of the story that James was just talking about. You and your colleague Carolyn Johnson wrote, "There's a good chance the coronavirus will never go away." This is not what we want to hear, William. So talk to
Yeah.
us about what the experts are saying in terms of the progress of a vaccine. And then after that, we can talk about, is the vaccine going to be the silver bullet that will help all of us return to normal? So what do we know about the vaccine process?
Sure. The vaccine is going to take a while. When we say vaccine, it's not just the development and testing and safety of that vaccine and its effectiveness, but the deployment of it. So we're talking about a process that could take years, possibly even as long as a decade, to really fully deploy. Because first you have to make sure it's safe. First you have to even come up with a viable vaccine is effective, and then you have to make sure it's safe. And then you have to convince people to take it, and you have to deploy it widely. And the supply, so there's a few problems. One is in the initial years after they have a vaccine, say they really are make amazing progress, and it's available in a year, you have a supply problem that is going to be it's going to be a bottleneck. Just like you're seeing with PPE or ventilators or anything like that, there's going to be hard decisions that have to be made. Who gets it first? What countries are going to get it? How much cooperation is there? If China, comes up with the best vaccine first, or if Europe does, who has access to that, and where are the manufacturing plants, and do they allow for export of that to other countries? So, for many reasons, international cooperation is going to be so key to this. So that's one kind of reason why vaccines are kind of far off. Another is, you're already, we already have vaccines for things like measles, the flu, chickenpox. There are things that could literally, like, are life and death. Like measles can be life or death, and flu too. Many people die from that. But we have such a hard problem convincing people to get vaccinated every year, and there's no reason to think this is going to be any different. And you're already seeing kind of anti-vaxxer movements gearing up. Some polls saying as many as like 20% people say they wouldn't take a vaccine if they were asked to. So that's going to be a major problem because we need herd immunity with vaccine in order to defeat this virus.
So what does that mean sort of in terms of the practicalities of how we think about the next couple of years? And, when we report on climate change, for example, there's the question of like mitigation or adaptation. Like, are we going to be able to stop it, or is it time to adapt and figure out how you live in a world that is changing and that change is coming? So are we talking about adaptation here as we all think about the future in terms of coronavirus?
Yeah, I think it's definitely both. We have to be fighting the virus as well as changing the way we live in order to limit the toll that it takes. And that I think for a lot of people, there's this kind of, we are naturally geared to think in dichotomies, like it's this or it's that, it's black or white. And so I think with this too, we're either optimistic or we're pessimistic. And I think that's why you see this lurch between looking for cures. Like first, summer's going to take care of it, the weather, or where this drug treatment, like you saw the stock just shoot up when Moderna showed any kind of signs of progress, when remdesivir kind of signs of progress about that as well. And I think it's this kind of lurching between things because we keep thinking, oh, it's the worst, we're never going to get out of this, or oh no, we'll get out of this within a year, everything will be fine. And the truth is, it's probably not either one of this. It's going to be a very slow progress, and that's why long-term thinking is essential. Yeah.
And James, in the meantime, we're talking about changes in our daily lives and daily habits. The piece that William wrote has this great image of people sitting out in a park in San Francisco inside little circles, right? Circles in the grass that are spaced apart, so you know where you can be in your safe space, socially distanced from other people who are enjoying the outdoors. This means
one of the challenges, Libby, is that we do need to change sort of the way we live in ways that aren't always fun. I think you're taking a risk when you make contact with other human beings. That doesn't mean you can't make contact with other human beings. It just means you have to be kind of calculating about what those risks are. One of the dangers that makes modeling really hard right now is that as they roll back these restrictions, there are a lot of people who aren't watching the show right now who don't understand that doesn't mean the coast is clear. And so I think that, one of the things that the public health experts I talk to worry about is, are people in DC going to go and have parties this weekend because they think now it's okay to do that when it's really not? And so this new normal, you can draw circles, you can tell people you still have to socially distance, you can keep reminding people you've got to wash your hands. I think William's point is so key, which is so many people just want a solution. They want a panacea. It's kind of an American thing almost to ask for that silver bullet. Tom Frieden, the former director of the CDC, says that all these smart people he talks to who aren't in his world say, tell us the one thing that we've got to do to fix this, to deal with this. And I don't think that's just from a public policy standpoint. I think that's also from a personal standpoint. Like, tell me what I've got to do. And what Tom says is, there's not one thing. The one thing you have to learn is there's not one solution to this. There's a lot of different things that you have to do, and that includes social distancing. So I think a change in behavior is required. And I think it is worrisome that a lot of people don't really seem intent on sustained changes to their behavior until we don't just get the vaccine, but get it rolled out and develop herd immunity, and improve testing, improve contact tracing, all that stuff. And so that's, I hope people watching take that away, is that you still have to socially distance even when the safer at home orders are lifted.
All right. Well, I want to thank William Wan, health and science reporter. William, thank you so much, and appreciate you spending time with us today. Thank you.
Thanks for having me.
James, one thing we've been watching as the story has unfolded is just the priorities the president is demonstrating. So I wanted to ask you about that a little bit. We talked earlier about President Trump's sort of signaling on masks, but we did have a question come in from one of our viewers. Shauna in Texas asked, why won't President Trump act as aggressively on coronavirus as he acted towards Twitter after it fact-checked his tweets and the president, sort of leapt into action right away? And as you get ready to answer that, let me just say hi to Heather Long, economics correspondent. Hi, Heather. So James, there is a question about what President Trump could be doing and should be doing and what his attention is directed towards right now.
Yeah, to Shauna's question, I think, initially the president thought he could just manage expectations, that, he doesn't want to be, he's more focused on the economy than the public health side of it. That's his background. That's his interest. The people that he's closest to aren't the scientists, but the Wall Street and CEO types who have pushed to keep the economy open, to reopen it from March on. And so I think he doesn't want to do anything that's going to, I think he thinks that his reelection is going to be driven based on how the economy is doing. And as he's said repeatedly, sometimes the cure is worse than the disease. And I think that very much is his mentality. When you look at tens of millions of people filing jobless claims, I think that's what preoccupies him the most. And that's what's blocking him from taking more decisive action. If you asked him that question, what he would say is we have taken decisive action. We've spent more than $7 trillion, if you include Federal Reserve stimulus, on trying to jumpstart the economy and prevent us from creeping into a depression. But I understand the question, and I think it's that desire not to get crosswise with the economy.
Well, that's a perfect segue to
It
Heather
is.
on. So thank you, James, for that excellent setup. Heather, these numbers out, just a lot of tough numbers today when we're talking about the death toll, we're talking about the infection rate, but also when we're talking about the number of jobless claims. So 40 million, more than 40 million Americans have filed jobless claims in the past 10 weeks. It's hard for us to conceive of what that number means. What does that number mean to you, Heather, as someone who swims in numbers all the time?
Well, I think the easiest way to think about it is 40 million is basically 1 out of every 4 American workers who had a job in February does not have one now. And that is really astounding. And I think almost everyone who's reading this or watching this probably knows a few people who have been laid off. I certainly do personally, in addition to people I'm talking to as a journalist. And the numbers are staggering, and it doesn't necessarily add up when you look at that map of where the deaths are and where the cases have been the heaviest on that health toll in places like New York City or in parts of Seattle. That is not where the economic pain is. It's very interesting. The economic pain is worst of all in places like Hawaii, hit hard by the tourism shutdown. Michigan, key swing state, is actually the second worst. They definitely have 25% unemployment there. So there's a bit of a mismatch at times in where the economic pain is hitting much more across the country than sometimes the health toll is.
Heather, as we watch states reopen and go through various phases, what are you watching in terms of how governors and state leaders are trying to think about how they help these people and help businesses get back to work? What are you watching, Heather?
The number one thing that states should be doing a better job of is getting relief, getting these unemployment checks, weekly benefit payments out to workers. One of the things that shocked me, in addition to seeing 40 million Americans applying for unemployment today, is the fact that there's another number in that report which tells you how many people are actually receiving those benefits. Some people are talking about how generous those benefits are. The reality is only 21 million Americans, so about half, are currently receiving those benefits. And that mismatch, I know you and I have talked about it before, Libby, but that's why we're seeing so much financial pain and strain across this country. Congress thought they did their job in March and early April by passing these trillions of dollars of aid, but if it doesn't get to the people who really need it right now, what good is it at all? So I'm definitely watching those numbers carefully. Obviously, we're all watching to see how businesses reopen and whether or not there's another spike. If that health spike happens, more cases, we have to shut parts of the economy down again. That's going to be really devastating. The final number that I keep in my mind as more of an economics thinker is 6 months. So what we know from economics and from past recessions is when people lose a job or get furloughed or unemployed, they have a pretty good chance of getting rehired within 6 months. But once they've been unemployed for 6 months or longer, it's much harder for them to get a job again. It's much harder that you start to see these ramifications where people lose cars, where people lose homes or feel forced to put their homes up for sale. We're seeing early signs of that already. But that's what I keep watching, and why this June, July, August period is so critical for Congress and various governors to make the right moves.
So, James, if you're a politician in this country, what are you weighing and thinking about in terms of the I was going to use the word trade-off, but I'm going to pause. I was going to say the trade-off between sort of the health question and the economics question, because we are hearing from some experts who say that we've got to find a way to make them go hand in hand and not make it a trade-off. But what are these state leaders trying to grapple with and think about?
The second spike. As Heather said, and Heather put it so well. If there's a second spike, it's going to be worse. If you sort of like flip the switch, all of a sudden everyone comes back, people get rehired, and then there's a second spike and everyone gets laid off again. That's going to be far more devastating than easing back in a way that avoids the second spike. And, I know a lot of employers who are nervous about hiring people back, even as they're allowed to reopen, because they're afraid that they're going to have to lay them off again if or when there's a second spike. And so if you're a politician, that's what you're trying to avoid. And you're trying to show that you can, walk and chew gum at the same time, that you can balance those things. I think some governors have gotten too boxed in as all economy, and some have gotten boxed in as kind of like all public health. And the effective leaders have to show empathy on both sides of that equation.
Heather, you mentioned Hawaii. Other states that the Washington Post is pointing out are really struggling is Nevada, of course, so heavily dependent on the tourist industry there. 25% unemployment in Florida, and even California has more than 20% of its workers now filing for unemployment. Those are staggering numbers, and there is a question about, as we look at the America reopening map there in the corner of our screen, just how those states might make some progress, especially if you are dependent on something like tourism.
I mean, we all wish we had the magic solution there. Obviously, a lot of those states are arguing that by reopening slowly, they won't have that second spike that James was just talking about. So they're arguing that this will be better in the long run economically, that when they are finally reopening, they will be able to go, as opposed to, more like what we're seeing in New Zealand or what we're seeing in parts of Europe, where they have actually been able to reopen and stay open and be both healthy and economically healthy. But we just don't know. It's a risk. It's a major risk. And like I said, as we get closer to that 6-month mark, as we get closer to the end of the summer, we know 40 million Americans will not be back at work. There will be some that are back at work, but it is almost impossible to model right now how many that will be in the next few weeks. Congress is obviously trying to incentivize companies to bring workers back. That's how they structured that Paycheck Protection Program. The PPP for small businesses is meant to basically force small businesses to bring workers back by the end of June. So we'll probably see a bunch of companies trying to rehire in June. But to James's point, do they keep those workers on for August and September? That's the big question mark for me. And that's really where the focus of this next stimulus bill in Congress is. What do we do after July? We don't know exactly what the unemployment rate is going to be, but we know it's still going to be high. We don't know exactly what reopening is going to look like, but we know it's not going to be perfect. And certainly a lot of businesses like the gyms and these entertainment venues are still going to be at 50% if they're lucky. And that for some of them, they might as well be closed, because being open at 50 or 60% is not helpful. And so they're not going to need all those workers back. So that's where you're trying to create policy that encourages people who can go safely back to go back, but doesn't penalize people who can't. You don't want to just say, sorry, it's August 1st, you didn't go back to work, we're cutting you all off, all benefits whatsoever. And that's how the current policy is more or less written.
There's some places that are doing well, some industries and businesses that are doing well because of the new model, this new moment that we're in. And so there are places that are hiring, warehouse workers and things like that. But Heather, as we all know, some jobs are going to be safer than others right now. And so our colleague Tony Rome had a piece today where he was looking at the unemployment numbers and, mentioning that, if you look at ZipRecruiter, the job posting website, and track what jobs are open and available, what jobs are harder to get. Those safe jobs that you can do from the safety of your home, jobs that you can do while social distancing, are really going to be at a premium. I mean, to have one of those jobs, you are so fortunate right now, Heather.
Definitely. And there's been a lot of survey data from the Federal Reserve and the census that backs that up. This pandemic recession, if you want to call it that, or the great lockdown, I've heard a lot of economists, James probably has a good name for it. But, it's undoubtedly hurting lower educated and lower wage workers the most. And unfortunately, that's a lot of women and a lot of African Americans and Hispanics, people of color. This is much, much harder on that subset of workers. It's something crazy. The Federal Reserve survey showed, it's something like 30% of low-wage workers can do their work from home versus 70% of you and the three of us and people in these sort of white-collar, higher ed, college-educated workers. And that disparity really hits at home. The other statistic that just sticks in my mind is 40% of workers earning 40,000 or less lost their job in March. So again, when we think about who really needs help here, these people didn't have a lot of safety net. They didn't have savings they could draw on. And, this crisis of childcare. We got a lot of these schools not reopening. We've got a lot of daycares and summer camps that are closed for the summer. So even if their employer calls and says, it's your lucky day, you can come back to work, what do you do in that scenario? Are you making the right choice to come? Are you going to leave your kid at home? These are really difficult decisions that we need to grapple with right now.
And James, that's why many politicians are saying, like, childcare is going to be a crucial part of this, that there are some elements of society that are schools. So President Trump has been pushing for schools to reopen. So how is the president and the White House's messaging and goal setting in line with what people at the state level and the health experts are saying?
I think everyone, local leaders, Democrats and Republicans, are sort of thinking that way. Like, okay, we need to, if we want to reopen the economy, we need to figure out a way to have someone looking after kids. They don't want those nightmare scenarios where you have kids all not socially distancing in the parks, and then bringing it home to their parents and having a second spike of infections. So they are, I think a lot of the conversations about reopening are very practical that way. It's sort of like, what do we need to do? What are the trade-offs? There are risks either way. I had a fascinating long interview with Marco Rubio, Florida Republican senator, but also the chairman of the Senate Small Business and Entrepreneurship Committee. And he's planning to hold hearings soon that sort of look at some of these questions, but also look at what the very practical needs of a lot of these small businesses are. And, when we say small business, sometimes, that's a woman renting a chair from a salon to be able to cut hair. And she has 2 kids at home. And what support do they need? What support from the government can they get related to getting PPE? And what Rubio was concerned about in our conversation was a class divide emerging that he worries could actually lead to social strife, where the divide in the country is between those who can work from home and those who can't. The other thing he was expressing concern about is just how hard it is to get a job or to start a business right now, when you're stuck at home and when we're watching kids and all that. And so those are the kind of very practical challenges that they're going to have to work through. And I think that's where a lot of the conversations are, especially at the local level, the school district level.
James, you point out in your interview with Marco Rubio that he thinks about his parents a lot, who immigrated here from Cuba without advanced educations. His dad was a bartender. His mom was a maid. And he talked to you about the fact that they are exactly who would be sort of in desperate circumstances right now without an income.
And he had a bunch of, siblings. And so he was like, 35 years ago, if this happened, there's not the internet, they would have been out of work. We wouldn't have had any kind of cash cushion. We wouldn't have had people to be able to go to for money. And we would have been hungry. And, it would have been, maybe the community could step up, but everyone else in Little Havana was also, working in the service industry. So they all would have been laid off too. And so I think it does, and it does weigh on him, and I think that's why he identifies with a lot of these communities that have gotten left behind, and he worries that they're going to be left behind in the recovery. Especially with those dates Heather's talking about looming in August.
So Heather, you reported earlier this month that the Treasury Secretary has acknowledged that the US government might lose money, might lose the taxpayers' money as part of this sort of financial lifeline they're providing to businesses. But that Mnuchin was, accepting that as sort of part of the reality of how the United States is going to sort of get through this moment.
Yeah, I mean, as we're talking about these staggering numbers and talking about whether this country would re-enter a Great Depression, a decade long of people being out of work and of businesses closing, that's really scary. That should freak us all the heck out. And so the reason that so many economists appreciated what Secretary Mnuchin said last week, even though it sort of hurts to think, wait, taxpayer money would be lost on some of these, bailouts, or or they like to call them lifelines or rescues. The reason that you would do that and you would feel okay with that, it is far better right now to help more people and help more businesses, to err on the side of being too generous than it is to err on the side of being so cautious and so stingy that you only end up saving basically the A students who would have made it anyway, the businesses who were not really teetering, not really the C or D borderline students, businesses, you need to help those. And some of them are going to fail. Some, it's like teachers. Some of them you give their love to, you give a lot of effort to, and they still fail at the end of the year, even though you've really tried hard, they've tried hard. But you also know that you've rescued a couple, you've pushed a couple into the lifeline. So that's what Secretary Mnuchin was trying to say the other week, and hopefully we'll see if he's right. It doesn't mean we're going to lose all $7 trillion. I just want to I want to be upfront about that. What he's talking about is losing potentially, we're talking like 20 billion, 50 billion. These are big numbers, but in the context of a $7 trillion package, it would be very modest.
James, are there any interesting sort of political alliances that you see forming? You're talking about Marco Rubio, acknowledging and making sure, at least in his ideas and his hopes, to help people who don't have help otherwise, right? Who are really in dire straits here. And then we hear the Treasury Secretary saying, some money may be lost in this process. Are we seeing any alliances that you can leave us with, like a glimmer of hope of ways the Democrats and Republicans would
I don't
continue?
want to be the skunk at the garden party. But what has been striking in Congress is actually how partisan this has become. So, Rubio's talking about extending an olive branch, but when you're doing reporting, when you're talking to House and Senate people watching, and I watched Kevin McCarthy's press conference earlier today, and it's really striking how, compared to the first 4 phases of this project, the first 3 phases, this has become a very Republicans have a plan, which is to limit liability. Democrats have a plan, which is to give a bunch of money to states and local governments and other stuff. And so right now they're at loggerheads. They'll reach a compromise. They'll figure something out because they have to, and everyone gets that they have to. But I'm actually struck by there's not really the kind of coalitions forming that you'd expect. Some will. Some of the deal makers will come up with ideas. But right now we're really not seeing that on Capitol Hill.
All right, James Hohmann, national political reporter and author of the Daily 202, and Heather Long, economics correspondent. Thank you so much to both of you for being with us today.
Thanks, Libby.
Yeah, thank you. And we all need other things to think about besides, of course, these challenging milestones we're hitting. And in that vein, Washington Post will be doing something totally different on Saturday. We will be broadcasting live the next attempt by SpaceX to launch NASA astronauts into orbit and get them to the International Space Station. You may have been watching yesterday. We were broadcasting live, and they had to scrub the mission, postpone just about 16 minutes away from launch because of weather. Well, they're trying again Saturday afternoon, and I will be in the anchor chair broadcasting from the Washington Post newsroom starting at 2 o'clock Eastern time. The launch is scheduled for 3:22 Eastern time, so you can find us on the Washington Post homepage. You can also find us on the Washington Post's YouTube channel. Go ahead and click subscribe if you're watching on YouTube, and you'll get alerts for when we do our big events like that. So we look forward to seeing you on Saturday. When NASA was asked about why they're going forward with this, even in the midst of the coronavirus pandemic, they said it is essential to keep the progress going, to continue the American role on the International Space Station. And so they're moving forward with this, and we will be right there watching it all unfold. So I do hope to see you on Saturday. I'm Libby Casey. Thank you for watching, and be healthy and well.